Hello again. So what is Apert syndrome? Apert syndrome is a genetic syndrome that is caused by a random mutation of the FGFR2 gene. Apert syndrome has multiple characteristics. The main characteristics are craniosynostosis, and what that is in non-Apert syndrome babies, when the baby is born, they have the soft spot and they have the 4 different sections of bone that leave room for the brain to grow. In Apert syndrome, craniosynostosis causes those bones, that space, to close and those bones to fuse prematurely together. So the brain doesn't have that room to expand and grow. So what's called a postcranial vault or cranial vault reconstruction surgery is needed. And that is usually done around 3 months of age. The doctors have to go in. They create a zigzag scar from ear to ear. And what that does is it allows the neurosurgeons to go in. They place what's called distractors. And distractors are 2 little metal screws or hooks, actually, that kind of come out. They kind of look like ladybug antennas. And you have a screwdriver. And you click the screwdriver twice a day for usually 30 days. And what that does is that opens those sutures that fused prematurely. It opens those up and it gives the brain the room that it needs to grow. So that is basically the short version of craniosynostosis and the corrective action that is needed for that. It's not just a cosmetic surgery in that aspect. This surgery is actually necessary because the brain has to have that room to grow so the baby can grow and thrive and do all the things that the babies need to do. Another characteristic is the syndactyly of the fingers and the toes. And what syndactyly is, there's 3 different types. There can be spade-shaped, mitten-shaped, and rosebud-shaped. And forgive me, I don't have a clear picture of the spade shape. But the mitten shape is basically a mitten. You've got your thumb and then the fingers are fused together to look like a mitten. The rosebud is where all the fingers are fused with the thumb and it looks like a rosebud. And then the syndactyly of the toes are all fused together in the mitten form. Another characteristic is what's called mid-face hypoplasia. And the mid-face hypoplasia can cause multiple separate issues due to the nasal cavities. Mid-face hypoplasia is what causes in Apert syndrome kiddos the top jaw to be pushed back, the cheekbones, the nose, and the forehead, it causes them all to be pushed back. And what this can cause is fusion within the nasal cavities, which can cause sleep apnea. With my daughter, hers are completely blocked from the midline up to the top. And so she had to have a trach at 6 months old. And it also causes some of the kiddos to have other airway concerns. The mid-face hypoplasia also attributes to the eyes having the appearance of being more bulging. Sometimes the eyes aren't fully symmetrical. And what happens with that is the eyes don't have a brow bone. So the brow bone is pushed back, and so then it varies, but most kiddos around 18 months to 2 years of age have to have what's called a frontal orbital advancement. And that is where the doctors go in and they bring forward the forehead and the eyebrows, and it gives them the brow bone that gives the eyes the protection that it needs. The frontal orbital advancement has also been known in some kiddos to actually help with their breathing and to help them with their sleep apnea. That's been in some of the kiddos, and they've been able to either reduce their use of the CPAP machine or do away with it altogether in some of the cases. The Syndactyly, some people do have the toes separated. Some of them, they need to have it separated because the bones aren't forming right and it's causing pain and causing walking issues with the kiddo. And in some kiddos, it can be something that, like, for instance, my daughter Emma, her surgeon is just watching her progress with her toes. And as long as it's not causing her any pain or any issues walking or any issues with wearing shoes, they're treating it as cosmetic. And so it'll be something that we'll let Emma decide later on down the road if she wants to have them separated or not. The fingers, we were advised that the fingers were necessary. Just Emma had the mittens, and we were advised that it was necessary so she could have the pincer grasp, so she could be able to write, so she could be able to grasp objects better. And then, of course, with the children that have the rosebuds, it's necessary because it gives them all 10 fingers, which is super exciting whenever you see the rosebud go from the rosebud to 10 individual fingers. It's really exciting. A lot of the Apert kids, they do have things like occupational therapy, physical therapy, speech therapy. Some of our kiddos do have feeding tubes. Some of our kiddos have trouble gaining weight. Emma had trouble gaining weight, and so she had to get a feeding tube. She's 3 years old. She still uses her feeding tube, but she does also eat everything in sight. One of her favorite foods is Takis. So she likes her spiciness. But she does eat orally. She just doesn't eat enough orally to be able to get rid of the G-tube. Some of our kids have trachs. Some of our kids have VP shunts, which the VP shunt is needed because some kids develop hydrocephalus, and that it's needed to drain the excess spinal fluid off of their brains, and to relieve some of the pressures that they can have. Our kiddos, a lot of them see neurosurgeons, ENT, pulmonologist. Some have to see cardiologists because some have heart issues, plastic surgeons. What is the other ones? Oral surgeons. Some children, depending on the severity of the individual itself, some kids could have 5 doctors, some kids could have 10 doctors. It really just depends on the severity. I think for right now, that's basically kind of a large, broad scale overview of what Apert syndrome is. In the next few days, there'll be some interviews with some of the other moms. They'll be able to tell you their stories and their experiences and talk to you about their doctors and their children and just the progress that their kids have made. And from there, we're just going to keep building each day with a new video. And we're going to celebrate the month of June, which is Apert Awareness Month. And we're just going to celebrate this month and share our stories with you guys. And we're going to, after the month of June is over, we're going to keep sharing just because we want to be able to have as much information out there as possible. So if you have any questions, if you want to reach out, please don't hesitate to comment. Please don't hesitate to click on the email below and shoot us an email. And we look forward to talking with you soon. Bye.